Hello, world. It's Dr. Thompson here from One Health Lessons. Happy Webinar Wednesday. I am so happy to be bringing to you Dr. Renzo Guinto, coming straight from the Philippines. He has been everywhere there, and we will cover that together. I know Dr. Renzo because we had the Lancet Planetary Health publication back in November of 2020. We also spoke with some fantastic One Health colleagues in Africa during a conference. Oh my goodness, that was, I think, back in January, February.
Yeah, early this year.
Yeah, so it's a pleasure to speak with you again and share your knowledge and wisdom with the rest of the planet. Thank you, Dr. Renzo. Can you please introduce yourself, because I will not be able to cover everything that's in your past. You have had such an incredible career so far, so please, the floor is yours. Can you tell us your story?
Well, thank you so much, Deborah, for this wonderful opportunity. First and foremost, I'm a big fan of your work, One Health Lessons. Every time I meet someone in LinkedIn and Dr. Renzo, I'm interested in planetary health, One Health, and I ask them about their experience, their background, oftentimes they would say, oh, I was a part of the One Health Lessons internship program. And so, it's just amazing how you have been an agent of, spreading the good news of One Health, planetary health to, different parts of the world, especially to young people, because that's what One Health Lessons really is catering to. So kudos and more power. So, well, thank you again for this opportunity. Renzo Guinto here. I'm a physician by training. I know, Deborah, you're a veterinarian, right? And so, and oftentimes, doctors like me and veterinarians like you don't talk to each other, right? And that's why One Health came to be. I'm a physician by training, but early on in my medical school days, I already acknowledge the interconnections between environment and health. I come from the Philippines, as you mentioned, although you also said I'm kind of everywhere, especially in the online space, in the era of Zoom. Right now I'm with you in the US. Early today I had a meeting with someone from Europe. So, but I'm right now in the Philippines. Where I'm practicing as a public health and a planetary health professional scholar. But again, going back to what I was just saying a while ago, when I was younger, I already saw firsthand, the importance of, really looking at health from a much broader perspective. The Philippines, for instance, is one of the countries in the world in the front lines of the climate crisis. So this is something that it's not an issue for tomorrow, for the next 10 years. It's already happening now. And when I was studying medicine, I realized, I cannot be just a doctor for my human patients alone. I have to start thinking about the future of the planet, because whatever happens to Mother Earth also impacts our health in return. And so I think that's quite the motivation behind my career in planetary health. Right now, what are my different roles? I wear so many different hats, all of them definitely interconnected. One, I established the first planetary and global health program of the Philippines in the St. Luke's College of Medicine, which is the leading academic medical center of the country. Second, I'm also the convener of Planetary Health Philippines. So it's a national network of Filipino planetary health advocates, scholars, practitioners, all committed to advancing the field of planetary health in the country. And last but not the least, and you might be seeing the waves and behind me, it's moving waves. I just started a new position, and I'm doing this concurrently with my Philippine affiliations. I just started as the Chief Planetary Health Scientist of the Sunway Center for Planetary Health. It's based in Kuala Lumpur, Malaysia. It's hosted by Sunway University, one of the fastest growing universities in the world, which made a commitment to be the first planetary health oriented university in the world. And, part of the Sunway Center's tasks is to actually revamp the curriculum to make sure that planetary health is central to the education of all kinds of professionals. So whether you're from the accounting school or computer science or culinary school, we have a culinary school in Sunway, or nursing school, or art school, all of you will be taking a core planetary health course during your 4-year stay in college. So yeah, those are just some of my activities, and there's so much more. I can't go on and on.
Way to lead the way. So everybody, you can
well, like you.
But this is the beauty of the One Health approach, synergy of people from different backgrounds, different disciplines, different strengths. We come together and we solve and prevent health problems that affect the world. And I can just keep going and going and going. But this is about you and about planetary health and One Health. Can you help our listeners right now understand, or in your opinion, because I know all of these terms are fairly fresh, they haven't been around for that long. So in your opinion, how do you define planetary health? And then how do you define One Health, global health, public health? Can you help?
Oh my God.
Yeah, I know.
We need an entire dictionary of all these phrases, right? And of course, for our listeners, let me just give some very basic definitions. Of course, One Health, which Deborah has been championing worldwide. We know that it's this approach that brings together human health, animal health, environmental health. That is the classic definition, right? Of course, One Health, it's embedded in it is the concept of transdisciplinarity and a holistic approach. But One Health, we often imagine it as this Venn diagram of 3 circles of animal health, human health, and environmental health. Although, being someone seated in the Lancet One Health Commission, just a sneak preview, that Venn diagram will be changing. Okay, so because there's an evolving discourse around, is that Venn diagram quite limiting, right? Does it limit the power and the potential of One Health, right, to be more than about the intersection of the 3 circles?
Yeah.
Meanwhile, planetary health, and I want to just be bookish about the definition. You look at the Lancet Rockefeller report of 2015, and the basic definition is it's about the health of the human civilization and the health of the natural systems on which our health depends. So if you notice, it's the health of people and the health of the planet. So, if you're going to simplify it, planetary health somehow brought together the animal health and the environmental health circles of the traditional One Health conceptualization and brought them together, and it simplified it, it's people and planet. On the other hand, I think planetary health, and again, kindly refer to that report, it somehow advances the thinking beyond this earlier notion of global health. So global health is about the health of the world population, right? Of the global population. But the planet part is not part of the equation. And so planetary health advances it by saying it's about the health of the entire planet. And that means the physical aspects of the planet and the living aspects of the planet. And then when you say living, of course, the animals are there, the plants, which, by the way, unfortunately, when we have discussions whether using a One Health or a planetary health frame, the plant health is not very much given emphasis, right? Or even microbial health. Now there's a lot of this, conversation about microbiomes and the different microbes that constitute our biodiverse ecosystems. I think that needs to be even more emphasized, whether in the One Health space or in the planetary health space. And then, of course, the human health part is quite central. So if you notice, the definitions are slightly different. But if you come to think of it, aren't they similar, if not synonymous? Okay? And that's subject to debate. I think the jury is out. On the other hand, the way I reconcile it is, you know what? They're all one and the same. I'm pretty agnostic you know, and I can be a planetary health champion on one hand, and I can be a One Health champion. Or can we just make it one planetary health so that, you know, the world will be in peace? But the thing is, I think what we need to acknowledge is that, you know, and this is the political economy of knowledge systems, right? I think we academics are partly to blame. Okay, there are certain camps that advocated for these terms, even if you, again, if you go deeper, they're just basically referring to the same goals, the same objectives. You know, they espouse the same values of transdisciplinarity, humility, systems thinking, etc., etc. And so, you know, and maybe, you know, instead of I making a differentiation between the two, I just basically answered you by saying, you know, they're one and the same. I don't know if that helps, but I think we need to start breaking the barriers and encouraging more collaboration between the communities, regardless of which phrase or term or paradigm you embrace. I'll stop there.
You know what? I want to stand up and applaud you right now. Yeah, because what you just said is exactly the way I've been feeling for years, And I'm really grateful that you thought the same thing. And this, viewers, this was not rehearsed. We did not know that we share the same views. This is a completely live recording of a conversation here. But it's funny, Renzo, that you say even before you go to medical school, you already saw that connection between everything. A sick environment, sick people.
Indeed.
Sick animals, sick people, like it all makes sense. We're all connected. And so that's how I explain to people who have never before heard the term before of One Health. I say One Health is two things. It's a concept. It's that interconnection between our health and the health of the environment, animals and plants. This is what I say. And then the One Health approach is that teamwork. Is having this conversation like what you and I are having, coming from the human medical field. I'm veterinary medical field, but you know what? We are advocates for the planet, and we want water, healthy plants, and all of the above, clean air. So we come from different areas of the world, but we have a common mission, which is incredibly important. How did you get started starting these programs from seemingly scratch, it sounds like, with different universities? Did you ever think when you were a child that you would be doing such things?
Well, you know, when I was a child, I thought I'll be an engineer like my dad, or, you know, in high school, there was a time I was considering journalism. I love writing. I love, you know, storytelling, but also, you know, being a literature professor. I mean, the thing is, and this is the thing, you know, whether, again, One Health, planetary health, or even public health, right? These are spaces that require, you know, multiple lenses, you know, multiple approaches. You know, it's, you know, these require the confluence of many different disciplines. And that's why I think these fields or these spaces tend to attract people who are just interested in so many different things, right? You're interested in society, but you're also interested in animals. You're interested in, you know, the physiology of the human body or the animal physiology. But at the same time, you're interested in broader ecosystems or, again, the social, you know, social sciences, you know, anthropology, sociology, political science. And so I guess, you know, while I never imagined myself doing this kind of work when I was little, I think that was already a sneak preview of what would become of me in the future, because I'm just so interested in so many different things, right? And that allows you to develop multiple talents. That allows you to appreciate different lenses. And that also enables you to see the interconnections, you know, to connect the dots. So if you are in the One Health planetary health space and you have so many different interests, right? You're interested in antimicrobial resistance, but also you're interested in climate change, but you're also interested in, the ethics of our relationship with Mother Earth, or you're interested in even digital technology and how can we leverage it to advance One Health, don't worry, you're not alone. You're in good company, because we're people who have just an eclectic range of interests and talents, but also I think with a shared commitment to the improvement of people and planet's health.
Yeah, absolutely. And so you say that you work in public health. Do you also work as a clinician these days?
Not anymore.
When you were, did you see, were you having conversations, or was it just very difficult because you were kept to like 10, 15-minute appointments or anything like that? You know how it is in the clinical world. But how easy or how difficult was it to incorporate One Health or Planetary Health in your everyday clinical life, in your practice of medicine?
Yep. And so first, I only did clinical practice very, very quickly because, as I've said, early on in my medical school life, I already knew what I wanted to do, right? Which is to, do things outside of the clinic in the hospital. Because when I was a medical student, you're in the emergency room or in the operating theater, you see the disease conditions of the patients. And of course, these are serious conditions that need to be addressed. But then you start thinking, how can they be prevented? How can we make sure there are less of them who will enter the halls of, the medical palaces and instead address the root cause? And so because of that thinking, I decided, okay, I should be one of those who will get out of the system and address again the underlying root causes of ill health, especially of people. And then eventually you realize, many of the health problems faced by people are also experienced or confronted by, let's say, animals. Example, infectious disease, or even, it's interesting. It's not very recently, but it's only when I was already a practicing doctor when I got exposed to even cancers in animals. Of course, any living creature that has cells that are producing or reproducing should be experiencing such conditions. But we don't talk about them in med school. And then you realize, there's also cancer in animals. They also have tumors, and they also require both chemotherapy and surgery. And then you realize, why are we not working closely with the veterinarians, right? So those are some of my realizations. Admittedly, it's quite challenging to incorporate, let's say, One Health or Planetary Health into clinical practice, especially during that time. But now that I'm, more, I guess, knowledgeable and more exposed to, the myriad possibilities, I think there are so many things that we can do even as clinicians alone, right? In the way we manage our practices. We want to make sure that, our the way we operate the clinic and the hospital do not do additional harm to the planet. So it means, green energy or sustainable procurement. You can just imagine the PPEs and the syringes that we're using now during COVID times, are actually adding, negative pressures to the planet in the pursuit of health improvement. I think that's quite antithetical even to think about.
Right. And that is a reminder for a public service announcement that I'll give. When you have those masks, those single-use disposable masks, cut into the ear pieces so that those elastic bands don't wrap around wildlife, don't get trapped along certain areas. I've seen photos of animals get trapped in this way, and it makes me think, okay, every single time, if I have to use those masks, I'm cutting the edges. So remember that, everybody else. Thank you, Renzo, for explaining that, because when I'm back in the clinic every now and then each month, and if I ever have a shadowing students with me, I always say, it's not just the patient in front of you, it's the environment, it's the story, it's the it's the family life that this animal is coming to you with. So don't give a topical medication if there's a toddler in the house that puts their hands everywhere, including inside their mouth, right? It's getting that awareness that it's not just that living thing that's right in front of you. There's a story behind it. So it's that perspective, right? It's that shift. And I don't know where I acquired this. Maybe it was during vet school, but honestly, I think coming to the medicine field in general, just like you having that just idea that everything was connected to start off with, it makes your perspective shift, right?
Indeed, indeed.
So
Our medical training is quite the first word that came to my mind is isolationist, right? We're kind of isolated from broader society, from the natural environment. We're all inside a box where, which is called the hospital or the clinic. And so that disconnection makes our way of thinking also disconnected, from the broader environment, etc. And so, I would love to see the future hospitals and clinics to be close to natural environments, right? For example, even open air kind of facilities. Of course, it depends on where you are and what season is it. But the closer we are to environment, the more we will be wired to think that what we're doing, let's say the syringe or the mask, is going to not just affect the patient in front of us, but as you've mentioned, wildlife that is around us. So I think we need to also, and this will be innovation in healthcare, we need to also change the environments where healthcare operates.
Right. And I'm just thinking back to, and I would love to hear your experience, but for me, vet school, it was so hard. It was so hard. It was so much to learn in such a short amount of time, in 4 years. And my gosh, it's a lot. So I'm thinking maybe because it's so much, and in med school, it's so much to learn, that we have to just simplify in our mind that this is medicine. And then when you get out in the real world, or when you start to go into clinics in your 3rd or 4th year, that's when you're like, oh, well, people are coming from the outside. So what is your opinion? Do you think that it's just human nature? We like to categorize things, or is it because medicine is so hard to learn and it's complicated that we have to simplify it somehow? Or do you have any idea on that front?
Yeah, well, this what do you call this approach of classifying things, which somehow characterize life sciences. We need to blame who was that? I think Linnaeus, who started naming species, and that's because I think Mother Nature is complex, and we need some way of making sense out of the complexity. And so, naming animals, naming, plants, and then all the way to kind of putting things in boxes in human medicine. We need a bit of that, to structure our thinking, to make things more efficient and effective. But we have to also find ways to make sure that we don't end up oversimplifying the world, reducing its complexity, and we come up with short-term band-aid technical fixes to very complex problems.
Yeah.
And I think One Health or Planetary Health, again, it's up to you which paradigm do you want to embrace. I think they're quite, again, one and the same. I think this is an opportunity to remedy that, to correct that, to even redeem ourselves from that creeping disease of oversimplification and this reductionist approach. And in terms of operationalizing that, I think more of these kinds of conversations need to happen. Veterinary and medical school at the very least, but all schools in general should come closer together. Universities do play a critical role. our young people enter medical school, the university, the vet med school, if they are already exposed to these ideas early on, I think that will be quite a good preparation. Once it's embedded early on in life, it becomes a habit. It's harder to actually remove that from the young people, and that's why your One Health lessons is quite a good an important service to the world.
Oh, thank you for that. I know that time is running out and it's getting late for you out in the Philippines. So I wanted to ask, do you have any final words that you want to share with the One Health Lessons community and beyond?
Yep. So again, thank you very much, Deborah, for this opportunity. And I'm sure we can go on and on. There's so many things that we already know, but there's so much more that we still don't know. And that's why I always say that there's so many unknowns, and therefore we need to keep on learning and learning, and we need to learn from people who are not like us. So this is also my encouragement to our listeners, to our viewers. You have to come up with a circle of friends, and these friends should be coming from different disciplines, right? So if maybe a veterinarian, maybe an ecologist, an economist, or a philosopher, right? Because that will enrich your One Health or Planetary Health toolkit. It will, widen your lexicon. If it will enable you to learn about different issues and problems, and it also will expand the possibilities for solutions. The options that you have. And so I'm always excited whenever I am in conversations with fellow non-doctors or non-doctors, non-human medical doctors, because it really enriches my knowledge bank, and also it widens the range of opportunities for affecting change. So that's my encouragement. And if you're in One Health Planetary Health, again, you're in good company. Let's not spread the virus of COVID. Let's spread the virus of One Health and Planetary Health. And I'm very optimistic, despite the suffering that we have now in the world. I'm very optimistic that if One Health Planetary Health indeed become, the main paradigm, our main compass for our post-COVID future, then we will be in a much better place, hopefully sooner rather than later. Thank you again, and stay safe, everyone.
Folks, if you want to follow Dr. Renzo Guinto, follow him on LinkedIn, and you will see he is absolutely everywhere. Absolutely everywhere. Is there any other social media avenues that you wanted to share with folks here?
Sure. Twitter at Renzo Guinto, LinkedIn. Just type in my name. I am also in Instagram. But also, please visit our the web page of Planetary Health Philippines, planetaryhealth.ph. You will see the faces and of the Philippine Planetary Health community, and also follow us on Twitter, Sunway Planetary Health, and you will be updated about our activities. Thank you again.
Wonderful. It's been such a pleasure. Thank you for joining us, Dr. Renzo. Thank you for joining us, world. It's been an absolute pleasure to be joining you here today, and I will see you next time. Onwards and upwards.